Hi everyone, I'm Alicia, and today I'm joined by Dr. Bilski from Bilski Dental Group. How are you doing today?
Great, good morning.
Good morning, thank you. So in this video, we're going to be talking about bone grafting and tooth grind. So I don't know much about that. I'm going to turn it over to you. What can you tell me about that?
This is the best time when nobody knows what I'm talking about. Probably one of my favorite procedures. In our business, in my office, we do dental implants. Mm-hmm. And sometimes we have to take a tooth out and do what's called bone grafting, and that's scary to most people. Mm-hmm. Bone grafting and using tooth grind means we take a tooth out like you see here on the x-ray. That last one to the left, we remove it and then put it into a process that is cleaned. We remove any old silver, that black filling that you saw in there, we remove that piece. Mm-hmm. Then we move on and place it in a Mr. Coffee type grinder. And if you see in the next slide, it is just sitting in what we would call like a Vitamix blender. Uh-huh. And that goes on high speed for about 10 seconds. And once it's ground up into little particles, that's the size particle that we want to use in the opening, the socket, the hole that is remaining from the removal of the tooth. Okay. So when we take a natural tooth that does not have a root canal in it, we can grind it, sterilize it with alcohol and some bleach and buffer it. It takes about 15 minutes. Okay. Then in our office, we call it a little mini dental hospital. We have a phlebotomist that works in our practice, draws the blood, just like if you were going in for testing and then with your doctor at the hospital. And she'll put your blood in a tube and spin it. Okay. And if you've heard of stem cells before, mm-hmm. Stem cells are the best parts of us that's undifferentiated cellular material, meaning it doesn't know what it wants to be until it's mixed with something and put back into your body. So we take those particles, and the tooth particles compared to bone are almost identical in composition. Wow. So the doctor term hydroxyapatite, HA, is what we're putting back in there really, and allowing your blood to coagulate, make a clot. Then it's called turnover, because your body and your brain recognize that that's a natural piece of you. Mm-hmm. And it knows that there's been trauma because the tooth has been removed and ground. It starts to turn it over so that particulate matter that we put in there, mm-hmm. those crystals, are dissolved. Okay. And then new bones. So think of it as little Pac-Man, this Pac-Man coming in, eating those bone crystals. And then the cavalry's coming back behind it to put the new stuff down. Oh, wow. So osteoclasts, bone chewers, and then osteocytes, bone formation cells.
Wow, that's incredible. I had no idea that could even be done.
3 months later in the lower jaw, it's as solid as your natural bone. And if this woman chooses to move forward with a dental implant, we can put the dental implant in. In this case, it was a wisdom tooth area. We're not going to worry about that. Yeah. If it's up in the front area, upper jaw, lower jaw, it does not matter. Upper jaw takes a little bit longer. It's just the nature of the jawbone. Okay. So 3 months in the bottom, 4 months in the top teeth. We can do whatever we need to do with that. If you don't want an implant, we can do a bridge, a part. So there are a lot of options.
You have options, absolutely.
But it's an alternative to using what we would call cadaveric tissue. That means like organ donors, those people have passed, and we take the organs. In this case, those people that have donated their bodies, their bones would be taken and ground up into the same crystal size that you saw in the previous, but it would be somebody else's. So there's a lot of religious people or physicians that would prefer not to use someone else's body parts. Mm-hmm. So here's an alternative.
Wow. So there's a lot of options.
A lot of options.
So many options.
Yes.
Wonderful. Well, thank you so much for telling me a little bit more about that. I'm sure that's going to be a big shocker to a lot of people, because I had no idea that was possible.
Just like you said, we have patients come in here and say, hey, by the way, you're going to need a bone graft. And they're like, oh my God. I go, hold on a second. Let me just explain. It's really cool. And then I get excited. My staff gets excited. And we show pictures. And the short of it is they really do appreciate using their own body parts. Absolutely. So the joke, and this is just a joke, we use your bones to make our bread. We grind them up, put them in there, and then send you on your way.
That's so great. Well, thank you so much, like I said, for telling us a little bit about that. And obviously there's a lot of great information that you can find out through Bilski Dental Group. And if you'd like to find out more, you can contact them. You can call them at the number on the screen to make an appointment with Dr. Bilski, or you can visit them online at bilskidds.com.